Watching TVC Breakfast, time now to turn our focus on health. According to the World Health Organization, stroke is the second leading cause of death worldwide, claiming approximately 6 million lives each year. It's estimated that more than 15 million people suffer from stroke annually. The risks include hypertension, smoking, diabetes, obesity, and unhealthy diet. Well, despite its prevalence, stroke remains a treatable and preventable condition with timely medical intervention as well as rehabilitation, therapy, and lifestyle modifications, which all play critical roles in improving outcomes for patients. And let's explore this as a reality, so to speak, as we bring in to the studio here with us medical consultant, Chief Medical Director of Heritage Men's Clinic, Dr. Rasheed Abbasi, is back for us. Thanks, Dr. Abbasi, for joining us again on TVC Breakfast. And this issue of stroke is a very relatable experience for many Nigerians, especially, people having older ones at home and, all of a sudden, and, a quick research talks about some patients who survive, some survivors talking about something somehow going off in their heads, basically like maybe a sharp feeling. Just, talk to us about this disease. And I'm fascinated by what specialists are saying in terms of you surviving it.
Absolutely.
Right.
Absolutely. So the problem with it, and thanks for the opportunity again, because we're in that part of the world where our #1 problem in terms of health is cardiovascular. The silent killers, high blood pressure, diabetes, smoking, alcohol abuse, and all that. But if we look at the data, then we know that there is really fire on the mountain. 40% of anybody that has a stroke will die within 30 days. That is sub-Saharan data. And what exactly is stroke? Is any kind of injury or an insult to the brain as a result of interruption to blood flow. So anything that cuts off the blood supply to the brain cells is medically stroke. And there are two types. We have the dry and the wet stroke. What we get mostly in Nigeria is ischemic. So there is a blood clot that blocks the artery and prevents blood to get to the brain cells.
Is this the dry?
That's the dry. And actually, of all the bad, that is actually the safest to have. But the problem is we do not even have the intervention, because for any stroke, we need to be seen timely. So I say to the elites in Nigeria, the likes in Banana Island, VGC, Victoria Island, we don't have any chest pain center. We don't have any cardiac chest pain center. And if you are not seen within 45 minutes, you are a goner.
We don't have it in Nigeria or where? You mentioned Banana Island.
Absolutely, yes. They're all in Lagos. We don't have any in Lagos. I pointed to them because...
But do we have it elsewhere in Nigeria?
Yeah, we have it in Abuja, which is overwhelmed. It's only affiliated with the National Hospital. And that is not enough. If you compare with the size of Washington, D.C., we are less than 1 million people there. We have over 20 stroke centers. If you and I call 911 in Washington, D.C., I can assure you that somebody will be knocking at your doorstep within a few minutes. Because if it's a stroke, you should be seen for stabilization within 45 minutes. So to our elites, they're not even safe. Before they can get on their helipad to get abroad, they cannot.
And that time is crucial.
That time is crucial. If you are not attended to for a stroke, whether the sign or the symptoms is coming and somebody notices it, you need to be seen within 45 minutes.
Well, in terms of prevalence, are there particular demographic groups or regions that are disproportionately affected by stroke? And if so, why do you think so?
Absolutely. So the answer to that question is West Africa. Is mostly of black origin. And for us, they've attributed it to our sedentary lifestyle, our poor diet. We consume more salt than the salt manufacturers. And salt is a risk factor to high blood pressure. High blood pressure is the #1 risk factor for stroke. And it's followed by its 5 and 6, obesity, diabetes, which we are inundated with. Our problem here is not infection. Our #1 problem is cardiovascular diseases. High blood pressure, diabetes, obesity, smoking is now coming up. Sitting is the new smoking. Sedentary lifestyle.
But we've seen cases, I've read of, a particular patient, stroke patient, who says he was keeping up with his hypertension medication. And for him, he initially thought it was malaria symptoms, only that he saw that the right side of his body was, getting weighed down. He was feeling some heaviness. But he kind of swore that he was taking his hypertensive drugs regularly, and now is a victim, so to speak, was struck by stroke.
Absolutely, and that takes us to the other silent problem that we're having. Yes, this patient may have been compliant, but compliant with what? Taking fake medications, because we're inundated with medications that are not effective. He has been taking whatever was prescribed to him, but this is not the right medication for him. And because we don't have any centers where he or she can go, where the doctor can say, look, this blood pressure number may not be appropriate for you. Because we know for a fact that 89% of sub-Saharan people that get stroke get it in the morning. And most of them will tell you they've been taking their blood pressure medication. What about the diet? What about the activity level? They're not doing that. And he or she may also be diabetic. These are all additive risk factors that actually cause problems.
And that's a scary alarm that you raised now, alarm button that you raised now, that someone who is keeping, to all of the medications, yes, all of the prescriptions and all of that, but might be consuming fake medications. Yeah. So NAFDAC is doing a lot. We see what they do just to ensure that we don't have all of these things in the prevalence in our pharmacies. But is there something that is missing somewhere? Is there something, because if you are prescribed, if doctor prescribes a drug for you, yeah, you should buy the drug. Is it that people don't take it back to the doctor to confirm the authenticity of such?
Yeah, absolutely. They don't take it back. That's number one. Yeah, there is a little bit of the patient non-compliance because I saw you taking this and you said it's for blood pressure, then I start taking it. Or they just go to the chemist. But it's a problem. It's a larger problem because of the infrastructure. Yes, NAFDAC may be doing all they can, but let's take Lagos, for example. This is the 5th largest economy in Africa. We're over 20 million. We only have 29 general hospitals. We don't have a single chest pain center. We don't have a single stroke center. So even if you and I...
As sophisticated as our general hospitals are, yes, we don't have them.
We don't. So when you and I are coming, if you see me now and I'm having signs of stroke, maybe like my speech is slurred, for you to call 911, for me to get to the nearest hospital, 45 minutes is already gone. And so even if I have the money to get an helipad and get out, you are not able to stabilize me. Where are the doctors to stabilize me? So for you to call the best stroke expert in the world, they will say, hey, is this stable? It's not stable. You don't need me.
So it may be a no-brainer, but so what's the option with the present deficiencies we have?
Absolutely.
In the system?
I advocate that this is when we need private sector to come in, because I mentioned the elites on the island. These are people that can even support. It does not cost a arm and a leg to open a chest pain center or a stroke center. It's not only for their benefit, it's for the benefit of the masses. The old saying, health is wealth. There is societal wealth. We don't have it. And when we don't have it, yeah, the chicken is going to come home to roast. Any one of them, because stroke can happen to anybody. There could be anything that can cause interruption of blood flow. If that happens, yes, you have to be lucky for someone to be able to recognize it. Can they call 911? How close can you get to a facility, which we don't have any, to even stabilize you?
Nigerians are not aware of this. Nigerians just believe that whenever you talk to a doctor, whoever the doctor is, you just believe that the doctor will take care of everything happening to you. So is it the centers that we don't have? We don't have the specialists for it too? Is that
absolutely. So any trained doctor should be able to know the ABCs just to stabilize stroke. Yeah, the specialists are the neurologists, because we're talking about brain cells. That's the neurons. But because we don't even have the centers, and we are inundated with most of the risk factors, we're becoming more sedentary. We have high blood pressure. We consume more salt. We have diabetes. We're obese. So how come we don't even have all this?
And is that why we see younger people also, falling victims to this condition?
Absolutely. So this part of the world, sub-Saharan Africa, we are getting people less than 40 now having stroke. 40% will die within a month. Guess how many will die within 3 years? Over 80%. So we're losing quality of life, and it's high time we start paying attention to it. And we cannot be fooling ourselves saying we can fly to UK, Canada, even Dubai. 45 minutes, you need to be stabilized. If you're not stabilized, you are a goner. That's what the data tells us.
But there are several minutes before that 45 minutes,
that is critical.
Yes. So what are the things you need to watch out for? Are there signs and symptoms that you need to know that, oh, I think so-and-so is nearing, this difficult time?
Absolutely. The most common mnemonic is FAST. You are looking at the face. If my face appears to be drooling, you've seen me a couple of times, you're like, hey, something is wrong with you, because I may not be aware. Or the way I'm talking to you, if all of a sudden my speech is becoming slurred, you might call my attention to it, because the person undergoing it may not even realize it. As you alluded to, I may wake up and feel this arm is not right. What is going on? The sooner I get to it, the better. And to your basic question, in the Western world, we recommend taking an aspirin a day. Aspirin is one of the cheapest blood thinners that can buy you some time. So you can increase your 45 minutes to maybe 55 minutes. Then where are you going? What is the next step?
Taking aspirin, is it when there is trigger or when there is a crisis, or you just take it on a normal?
No, the recommendation is for 40-year-olds and above. Aspirin a day is good because we know you are not that as active, but we know that this is preventive. It's been proven over and over. You know, it's a decade-old medication, and it has a lot of benefits to prevent this.
And it can be abused.
Yeah, it can be abused, especially in people with ulcers. We tell them don't take it on empty stomach and all that. But we know that a lot of Nigerians have high blood pressure. They're obese, they're sedentary, they're diabetic. They need something like that.
All right, and this issue of aspirin being advised, your body will not be attuned to the fact that it takes aspirin, and so it's fine. It's fine. Basically safe.
Absolutely. Aspirin is acetylsalicylic acid. It's one of those common acids that your body and my body produce. What does it do? It prevents your blood cells from sticking, so it will not form a clot. Once it forms a clot, it's going to clog the blood vessel and it will disturb blood flow. So that's why aspirin is
okay. And this issue of early warning signs. So you discover, or someone close to you discovers that something is off around you. What can be done when the person presents himself early? So what do you do? Is it the injection that you spoke about? If it does come out to be a stroke indicator, what help will the person get?
Good. So the main thing, like what the study tells us abundantly, is you need to be able to get to a hospital or a facility that can take care of you. But let's say we're neighbors or we're family members and you notice it, give me a small aspirin. That buys you some time. When you get to the hospital, the doctor has to be able to assess you. Maybe they'll get a CT scan, because it can be done outside of the hospital. That's why we need stroke centers. Because not all patients can get the TPA. That's the injection you are alluding to. The TPA is a clot buster, but it's not ideal for all patients. It saves a lot if you get to the right place. And that's why I'm advocating that any of these elites, it does not cost a arm and a leg to settle, because it might be something that will save them before they can get on the helipad.
What role do you think technology actually plays in both preventing and treating strokes, and especially what innovations do you foresee on the horizon?
Absolutely. We need technology like yesterday. So now with telemedicine, once I stabilize you or I see something, then I can radio any of my colleagues at Yale, back in DC, Hopkins, and they can tell me, because they're so experienced that looking at your signs, they can tell me, look, Rasheed, you are dealing with ischemic, you are dealing with hemorrhagic, this is what you do. So technology can give us that abridge of time. And now we have, access to MRI that can actually tell me which part of your brain is being affected. So that way I can know where to direct physical therapy to. Because it's not only the acute stroke. Yes, early prevention is better, but what about the care afterwards? We're really in infrastructure desert. As rich as we have financial wealth, but societal wealth is missing. And you drive all across Island, VGC, I don't like naming, but you see them and you look, where is the chest pain center? What's going to happen? Any of these guys can wake up with a chest pain. They can wake up with just a tiny headache, and that might be the early onset of stroke.
Right.
Where are they going?
There are some times you sit in the AC, like we have the AC blowing in the studio, and then you feel a sharp pain in the middle of your chest.
Yes.
What does that tell you, in cases like that?
Yeah, exactly. In cases like that, if it was in this...
And you may not even be in the AC, and then you feel it even outside of it.
Exactly, because that is telling you that's not normal, because you and I are not supposed to feel that. That sharp pain may be a disruption of flow. So you need someone to see you and say, hey, even if this is a nothing, let me give you that assurance. It takes you get to a chest pain center, they do an EKG, we run blood tests, we do a CT scan, boom. It's either I get you the good news that, hey, I'm glad you noticed this, and now we can prevent it. Because that could be a TIA. That is the transient ischemic attack. It's the early sign before stroke occurs.
Okay, so we were talking about the rich and how this doesn't spare them. Yes. But, it's also even going to be more worrisome, for Nigeria with the burden of poverty and all of that. And, I'm just looking at all of that. And in terms of prevention, really, can we just, also talk about that? As in, what direct, realistic ways can one take? What steps can one take to prevent stroke? Because, for, like you said, now there is such a heavy burden. Many households have somebody who is, and they are managing for years. I know a case of, someone, a 30-year-old, he's now 80 or thereabouts, and then he has been managing stroke for about 30 years. Yeah. So how do you avoid it? So
we all need to be educated listeners or educated consumers. We need to know certain numbers, like the back of a hand. What's your blood pressure number? There's no stigma to this. If you have high blood pressure, it could be genetic, it could be the environment, it could be the stress, it could be your diet. The sooner you know what your number is, the better you can get to the doctor that can treat it. What's your waist size? If your waist size as a man is above 40, you're already increasing the risk. What's your neck size? If it's above 17, you're already increasing the risk for stroke. These are numbers that we should know. So that way we can now look that, okay, where do I even want to go? Who's going to be my doctor so I can prevent this? Because once you have it, the data is bad. 40% will die within 30 days of surviving a stroke. And within 3 years, 80%. So prevention is better than cure. And then, yes, if you can prevent it, then it depends on where do you go so they can stabilize you. Because the world is so global. You can fly anybody in that is an expert in this area, give you a clot buster, get you better. You go to physical therapy and you can regain your life back.
Where is the place of, because, oftentimes when we talk about the hospital, we talk about medicine, we look at the Western, idea of medicine. What is the place of tradimedicine, the reemergence of tradimedicine in, taking care of people? For instance, we have King of England who is seeking alternative medicine, for his ailment.
His ailment, yes.
Do you feel that they can also help, or they also help play, very important role in fighting this scourge of, stroke?
Yeah, absolutely. Because this part of the world, we know that the #1 risk factor for us is high blood pressure. The traditionalists will give you concussions with moringa tea, moringa seed, moringa leaves. This will lower your blood pressure. There are certain types of pistachio nuts that you can have that is rich in vitamin K. It will lower your blood pressure. As a prevention method. And so if we encourage them and, you actually put some money for research and development, you will find something local that is cheaper that will actually reduce your risk factor. If you are the type that you don't like to take anything because you are not sure, then go for regular walk. Let's increase our physical activity. We are such a sedentary generation. We are not created to fly or swim. We can only walk. 15 minutes of walk in the morning, 15 minutes of walk in the night will reduce your high blood pressure down. And that reduces your overall chance of stroke or cardiovascular illness.
So what are the do's and don'ts, for, especially when the crisis is actually, out there? Sometimes when people are involved in accidents, yes, you see people start carrying them, roughing, the rough and all of that, even causing more damage to the victims themselves. What are the do's and don'ts for people who want to help those who have been stricken, with stroke?
Good. So we need to do more of awareness. Let them know what are the signs and symptoms. So if I'm having it, I would rather have someone that is aware, that has a little bit of knowledge. Oh, this is a stroke. So if I have aspirin, let me give it. Let me make sure that I can lay him down so his blood pressure can be a little normalized. Don't give me any blood thinner. Don't give me something like ibuprofen, even if I'm having headache. Because if it's a stroke, you can convert a dry stroke to a wet stroke. So we need a lot of awareness. And that's the essence of the Western world. Every so often, I've been licensed for so long, I still have to go through stroke protocol. Because I might be the only doctor around when someone shows up. I don't have to say, oh, I'm a cardiologist. That's not. No. You provide that ABC, CPR earlier. So, yes, we need that awareness because we're in infrastructure desert. We don't have anywhere to go for rich and for the poor folks.
And perhaps that may also be, a quick fix option that government can do now while we work towards the establishment of stroke centers. Absolutely. Right.
Yeah, because we can convert some of our healthcare centers. All it takes is just have a floor, and then, hey, this will be your stroke area. And you could have one designated for a whole local government. So that way, if someone shows up, hey, let's activate Dr. So this is his area. And it's a team, because, no man is an island. It's a team. They come in, the nurses know what to look for, they know what to do, they will screen you, they will set you for CT scan. We don't have that.
And speaking from a personal experience, you know, I guess that may be also the reason why, you know, we have, you know, many Nigerians who say they would rather not go to the hospital where they see the projections of a stroke. They would rather, you know, seek alternative, you know, medical, because when you weigh the time, by the time it gets to one's turn in the hospital, the 45 minutes margin is gone. And so why don't you just, you know, perhaps use, you know, some other quicker methods and yes, all of that.
And that's the reality, because a lot of people will say, oh, let me just go to so chemist, because he or she is thinking, if I get to Lasicom, I'm going to be overwhelmed.
The condition will be worse.
The condition will be worse. And so that's why, but if we look at it, we're losing more either way, because it's quality of life. I mean, if 4 out of 10 people with a stroke is going to die within 30 days, that's, I mean, it's just unacceptable. Not to talk of a 3-year number that is above 80%. And we have swaths of local government, and we're just infrastructure desert. So for the rich and for the poor, there is no way to go. And it's easily preventable, because we know what are the risk factors. Easily preventable. Wow.
So you recommend, you know, some of the recommendations that you made. I know that you talked about the last time you came on the show. You said, you know, walking 15 minutes and all of that. Does, you know, do something like that also work for, you know, prevention?
Absolutely, because this stroke, CVA, is a subset of cardiovascular, and we know that activity, increasing your walk in the morning and night, reduces your risk factor, especially your blood pressure. If your blood pressure is less, there is less chance for stress on the blood vessel. So no chance for having wet stroke or dry stroke. So yes, something as simple as that. Watch what you eat. I know it's not everybody that can afford to eat at home, but avoid the salts, avoid all this loaded sodium, because it's going to shoot your blood pressure up.
All right, Dr. Rasheed Abbasi, we hope Nigerians are wiser now with this, you know, nuggets that you have just shared, and we hope that we can work, that more Nigerians will work with this advice that you've given, this to ensure a healthier society.
And take a walk every time they feel.
Absolutely, absolutely. They are very doable. Thanks a lot, Dr. Rasheed Abbasi, for speaking with us.
Thank you.
Right, it's a Friday.